screening and testing for COVID-19 in that province. The launch will be at the Jika Joe informal settlement in Pietermaritzburg. Our reporter Simphiwe Makhanya is standing by to tell us more about this and how people are feeling about being tested. Simphiwe, thank you very much indeed for coming through. Tell us why Pietermaritzburg at this time.
Thank you very much, Blaine. Good morning to you and good morning to the viewers as well of the agenda. Blaine, we are at Jika Joe informal settlements. Behind me, I'm just going to ask my colleague Raymond Mbele to show you some of the equipment that will be used in this screening and testing exercise that is being done by the provincial government of KwaZulu-Natal. You'd recall, Blaine, that the province of KwaZulu-Natal has recorded over 500 confirmed cases of COVID-19, and what is more worrying is the fact that of the 7 fatalities that were reported yesterday, 6 of those come from this particular province. And the concern also, Blaine, when you were speaking to Sipho Stearman earlier on, you spoke about the issue of social distancing, and you know that such areas as Jika Joe informal settlements, you hardly find that. So the provincial government has come here to actually engage with these residents and also screen and test them. Let's speak now to the KZN provincial government spokesperson, Mr. Lennox Mavaso, to see what we can expect as the day unfolds. Mr. Mavaso, thank you very much for your time and welcome to the program. Why Jika Joe informal settlements?
Well, you will know that the Jika Joe informal settlement is one of the areas that we consider vulnerable because of the number of people that you find around here. It is very important that messages of education and awareness are able to be disseminated to the broader society so that we make sure that we curtail the disease, we keep the spread of the disease because, you know, as it was indicated during the presentation that was led by the Minister of Health during the course of the week, we've got to make sure that the disease doesn't get transmitted to the second person. It must reach a dead end so that we can flatten the curve. So we are coming here because we want to make sure that we flatten the curve, and we'll do that when we are able to make sure that people that live in areas like informal settlements are able to be screened, are able to be tested, and they are able to get the messages so that they understand their roles and responsibilities in terms of what they can do to flatten the curve.
Mr. Mabaso, let's speak now about the issues at the private hospitals. St. Augustine Hospital has been shut down. We understand also that Kingsway Hospital has been shut down. It looks as though that the private sector is not very much well equipped when it comes to actually deal with this issue of COVID-19. How is the provincial government going to intervene to ensure that these hospitals are actually functional during this very critical time?
Well, there's an intervention that our Department of Health, led by MEC Nemakukusmelane Zulu, is leading across hospitals, public and private, to make sure that we're able to manage this particular virus from spreading. As you'll know, it's a novel COVID-19, so there are a number of issues that are emerging that we have to respond to, that we have to react to. But we are confident that our health practitioners are on the ground, and we are working together with the management of the private hospitals to make sure that we are able to immediately pick up the areas that may contain virus and anybody that may actually be infected and may lead to the virus spreading. So they are immediately isolated and quarantined, and that we don't have the disease spreading to everybody within the particular hospital. So part of the reason why there will be an immediate closure when the case is discovered is to ensure that it doesn't get transmitted to the majority of the people that are within the hospital. So we're able to ensure that the dead end is reached immediately from that person that has been identified, the case that has been identified, and that we are able to isolate and treat the person accordingly.
We've seen quite a number of health institutions raising concerns about the issue of protective gear in the province. As the provincial government, how far is the process of procuring protective gear to ensure that those who are in the front line of fighting this virus are actually protected?
Well, it will all be announced today, but I can tell you that the province of KwaZulu-Natal, there's been a lot of work that has been done by the Provincial Command Council, which is chaired by the Premier. That's one of the central work. Our cluster that is dealing with the social, we call it the social cluster, which is chaired by the MEC for Public Works and Human Settlement, MEC Peking Konyen. We have ensured that all these collaborative efforts are working towards ensuring that there is enough PPP that can be provided to our essential workers, because we know that they are at the front line, they are at the coal face. They are essential workers to all of us, because they are our frontline defense in terms of this disease. But they are also essential to their families. So it's very important that we are able to protect them. So there's a lot of work that has been done to make sure that there's enough protective gear to make sure that they are safe as they undertake this crucial task in behalf of the nation.
One last thing, Mr. Babaso, that I want us to look at is the issue of the fatalities that have been reported, especially in this province. Of the 7 that were reported yesterday, 6 of those come from KwaZulu-Natal. Any particular reason why that number is so high in this province?
Well, indeed, it's a tragic situation, and on behalf of government, would like to extend condolences on behalf of the Premier of the province, Premier Sihlezi Galala, and the entire government of KwaZulu-Natal to all those that have lost their loved ones. But it's really a strong message that we need to take this thing serious. Our people must heed all the messages, the call to stay at home, the call to make sure that we practice, we exercise hygiene all the time. We sanitize our hands, we wash our hands, and that we are able to practice social distancing. Indeed, is one contribution that we can make before we reach the tragic stage of death. Indeed, our hearts are with those that have passed away. But tomorrow when the provincial command council sits, that's when those deeper analyses will probably be done, where you will be indicated maybe some of the profile of the people that would have died. Our scientists and analysts and medical experts that sit in the command team will be able to provide that kind of information. So when the Premier convene a post command council briefing tomorrow, you will then be aware in terms of the trends and analysis regarding that particular question.
Mr. Mabaso, thank you very much for your time.
Thank you.
That's Mr. Lonox Mabaso. He speaks on behalf of the KZN provincial government. Blaine, one of the issues that we will be closely monitoring is the issue of access to clean water. The government has been at pains encouraging people to actually maintain a high level of hygiene. But you will ask yourself when you see informal settlements whether those crucial equipment are actually available to the general public. Blaine, it's back to you in Johannesburg for now.
Yes, Simphiwe, thank you very much indeed. You were talking about the fatalities that KwaZulu-Natal has recorded, 18 so far with regards to COVID-19 related deaths. And I'm just looking at this report, the statement by the health minister, and of the 7, as you were saying, 6 of them were from KwaZulu-Natal in terms of the fatalities. And a lot of the people that passed away, and may their souls rest in peace, had underlying conditions. A lot of them were over the age of 50 as well. But that doesn't mean that young people need to be complacent with regards to this. The WHO tells us that a lot of people under the age of 50 had to be hospitalized as well, around the world I'm talking about here. So, it cuts both ways in terms of everybody being infected or being affected by this disease equally. The chances of them being affected by this disease equally is there. So some people, we thank you very much indeed for coming through. We'll come back to you when things are up and running, the program is up and running, to get the very latest from KwaZulu-Natal. Simphiwe Makhanya live for us in Pietermaritzburg.